And I'm going to share my screen so we can start with the presentation. Okay. So you'll have to bear with me for a little bit as we're getting going here. And if folks have questions, it may take me a second to get to the chat to answer any questions. Folks will be muted. But if you have a question, just go ahead and throw it in the chat, and I'll be happy to answer those at the end. And if not, you can shoot me an email to exercisesmedicine@osumc.edu, and I'm happy to answer any questions as well. So the title of the presentation here today, does diet and exercise work? Well, we do know that diet and exercise works, and it works for many different things. But the point of the presentation today, so many folks heading into the new year are really looking to attack weight loss and weight management. So is it better if we do diet? Do we do exercise, or do we do both? So I'm just going to touch on some of the points here with the talk today. So just a little bit of background about myself. By training, I'm an economist and an exercise physiologist. I've been at Ohio State for over 10 years now. But the wellness program that I'm responsible for is Exercises Medicine, the Exercise Enhanced Weight Loss Program, our non-surgical lifestyle programs, Living Well and Healthy Living. And then I also do a lot of stuff in community health projects and research, specifically with exercise, focused on interventions to help treat and manage diabetes, cardiometabolic risk factors, while addressing health equity and weight management and weight loss. So kind of a jack of all trades, master of none. And like I said, I've been in Ohio State for about 10 years, and that's my family there, out getting a little exercise up at Allan Creek. So the first objective of the presentation here is, when we talk about exercise, we need to know how hard do we need to be exercising. A lot of times people hear about moderate and vigorous physical activity. Well, what does that actually mean? So physical activity, as described by the American College of Sports Medicine, bodily movement produced by the contraction of skeletal muscles that result in substantial increase in caloric requirements. So the amount of energy you're consuming or using over resting energy. When we look at exercise, is any physical activity of planned, structured, or repetitive body movements done specifically to improve or maintain one or more components of physical fitness. So a lot of times people will say to me, well, I don't need to exercise because I have a manual labor job. Well, manual labor jobs, although they do provide a lot of physical activity, they don't provide exercise, because our bodies are really good at adapting to our day-to-day activities. So if we're not exceeding either that rest or what our body has become accustomed to, we're not going to get the impacts that we really are looking for from exercise. So I like to think of it as a planned, structured, and repetitive motions involving major muscle groups to increase those energy demands or those calorie consumption demands that are above the activities of our daily life. Okay, so how long do we need to be exercising? We've heard about that 150 minutes per week, or 30 minutes a day, 5 days a week. But that's that moderate intensity exercise. If we want to start working out a little bit harder, so a jog or a fast cycling, singles tennis, something like that, that's what we consider vigorous intensity. And that's a kind of a 2-for-1. So you can see if you just cut that 150 in half, we need to do 75 minutes of vigorous intensity exercise. So something where you're really starting to get that heart rate up, having a little trouble, chatting with your friends who you may be exercising with because the breathing is becoming really labored. And then 2 days of general strength training for all major muscle groups. So 150 minutes a week of moderate, or 75 minutes for vigorous. And I kind of touched on this. So that moderate versus vigorous. So moderate activity, that's just a general walk, a lunchtime break, a morning stroll, evening walking the dog, playing around at golf. Vigorous activity, that's singles tennis, that jogging, or some cycling. So you do that moderate, 5 days a week, 30 minutes. Vigorous, you can cut that down to 75 minutes per week. So when we think of that, I want to put that in the context of how we're doing nationally, and then within the context of Ohio. So this recently came out from the CDC, the amount of the population that's meeting physical activity guidelines across the nation. So only a quarter of us, so even under a quarter of us, 18 or older, are meeting those physical activity guidelines for both aerobic and muscle strengthening activities. It's a little bit higher for men to meet those guidelines, and then those that are a little bit older tend to exercise a little bit less as well. So we got a lot of work to do, right? And people tell me all the time that they are exercising, but these are just kind of self-reported values. And that last bullet there is to point out, well, when we actually looked at strapping something onto an individual to see how much they're actually moving, less than 10% of the population is actually meeting those physical activity guidelines. So me as a wellness provider, an exercise physiologist, I've got some job security, but it doesn't seem like I'm doing my job too well. So I better get on it here to get the population motivated to meet those guidelines. So how are we doing in Ohio? So we're doing even worse than what the nation's doing. So in Ohio, around 20% of us, and then in Franklin County, kind of in between that lower bound and then the national average at 22%. One thing that I do want to point out that similar trends here, males are a little bit more active than females. And as our income disparities start to present themselves, those who have less income tend to exercise way less than those folks that have a little bit more disposable income. Same thing happens with education. So the lesser amount of education, the lesser amount of physical activity that we're doing. You see those college graduates just above that national average, around 27%. So this is all from the Franklin County Health Map. So hopefully we've turned that around a little bit, and 2024 is going to bring us into a better picture here. So that's the big question I just need to ask folks, and I kind of alluded to that a little bit there with that accelerometry data. Let's be honest, how much are we actually exercising? And I think, I put this slide in there because I put this on myself and the other healthcare providers that we need to do a better job of our messaging on the importance, the benefits, and what it actually takes to get these things done. So that's what we're going to transition to here quickly is, does the exercise actually work for some of the things that we want to be doing? So nobody really likes literature reviews, but that's what we're going to do. I'm going to go through a small literature review on physical activity, diet, and then a combination of those for both weight loss and weight management. So I am going to pause here for 1 second just to see if I can. I thought I was going to be able to see if there were any questions in the chat. Here we go. Okay, nothing in there, so I will keep going. Anybody has anything? Again, please enter any questions they may have in the chat. A lot of these slides I took from a recent talk that I did at the OSU's bariatric symposium, where we were really discussing the management of overweight and obese individuals through lifestyle modifications, diet and exercise, and then surgical procedures. So in 2013, the guidelines for the management of overweight and obesity recommended weight reduction for overweight individuals with one indicator of increased cardiovascular risk. So whether that's high blood pressure, high cholesterol, they're a smoker, they're not getting the amount of sleep that they want to do. And then weight reduction for obese individuals, anyone that is in that BMI of greater than or equal to 30. So the benefits of exercise have been, well established since we started researching these. And these improvements in cardiovascular risk with just a modest weight loss of 2 to 3%, but we recommend at least a 5 to 10% weight loss, which is what's considered clinically significant. And I think that's going to be important when we start to bring in this literature, is that clinically significant weight loss is 5 to 10%, and we want to do that within 6 months due to the most profound impacts in cardiovascular risk factors compared to modest weight loss. Is low impact Zuba considered moderate exercise? Peggy, that's a great question. And I would say that yes, low impact Zuba would be considered moderate intensity exercise. Absolutely. Okay, so exercise without any dietary restrictions. So this first study here looked at 18 months of individuals exercising 3 times a week for 30 minutes per session at that 60 to 75% of their aerobic capacity. So, we talked about 30 minutes, 5 days a week. These are doing 30 minutes, 3 days a week. And then they compared that to 5 times a week, 2 15-minute sessions of brisk walking. So again, that moderate intensity exercise. And what they found was about 2% reduction in body weight. So it's that body weight reductions that we're looking for to give you those improvements in that cardiovascular risk. But it's not getting to that clinically significant weight loss when we're talking about obese or morbidly obese individuals. So another study looked at 6 months. So, here we looked at just at 18 months. This was just 6 months, 50 and 100% and 150% of those guidelines. And you can see these respective weight losses. So we are getting some weight loss with just exercise, but it's not that clinically significant that we're looking for. And Peggy, another great question, success rate in diet exercise long-term. We're going to get to that in a couple slides, so bear with me as we just start to trudge through some of this data here. So great questions. All right, and then another one, 8 months of low amount, moderate intensity exercise versus low amount of vigorous intensity and high amount vigorous intensity. So just some variations on this frequency intensity. And basically what it says is in overweight and obese adults with various clinical conditions, aerobic exercise alone without dietary restrictions does not result in clinically significant weight loss. So it's great at getting some of those benefits for weight loss, but primarily moderate intensity and vigorous intensity exercise are really geared towards those reductions in cardiovascular disease risk factors. All right, so I'm trying to move this here a second so I can, having a hard time seeing my slides here. Okay, so again, 16 months of aerobic exercise and 10 months. And again, these are just looking at the amount of calories that they expended over time. And this Don Ladolf 16 months, and then this Midwest exercise trial 10 months. So that's just varying the intensity and the amount of calories that are burning. And we're starting to get into this, this more clinically significant weight loss of this 5.5% weight loss for males. And then up to almost 6% in this 10 months of, the 600 calories per session. So if we're really exceeding the amount of exercise that we're doing, so if we're going above that 150, we have a higher likelihood of resulting in that clinically significant weight loss compared to those lower levels. So a thing to remember here in this slide, this 2,000 kilocalories per week. And in the slide that I'm about to show you, it's going to get to that question from Peggy earlier about long-term adherence and how useful exercise is. All right, so combining exercise and diet, we look at 12 months of a low-calorie diet, so that 1,200 to 2,000 kilocalories per day, in overweight and obese postmenopausal women. Diet and exercise, about 11%, diet only 8.5%, and exercise only less than 1%. And as you would expect, right, so the higher attendance at the nutrition part of the sessions and exercise adherence had the greatest weight loss. So, if we see the combination of when we start stacking these things with diet and exercise, that's where we get the biggest bang for our buck. And then the more likely you are to attend the different sessions of exercise or diet, the much greater chances that you will have in having success. All right, so this is kind of the summary here of these combined diet and exercise programs. So 18 months exercise in those 3 days per week with that strength training. We looked at exercise group only, a 2% weight loss, diet only, almost 10%, and a combination exceeding that 11%. There's a lot of numbers that are being thrown out here, but the one thing, like I mentioned, I had used this at a presentation for the bariatric symposium, is I just want to kind of provide some framework of some numbers that can be expected from these types of programs, because in a few slides, I'm going to talk about how effective the programs are at Ohio State, just to see if we're in that same ballpark. So kind of what we're seeing here is when we're doing diet only or a combination, we're around that 10%, but that exercise only, we're less than that 5%, no matter which type of programs we look at in terms of those exercise only, whether that's moderate or vigorous, we're just not quite getting that clinically significant weight loss. So for the treatment of overweight and obese adults, calorie restriction in combination with exercise adherence is what we recommend. So physical activity and weight maintenance, and this is a really big piece, right? So once we get that weight off, we need to do something to actually maintain that weight. And that's where exercise really becomes important, because unless we have that combination of caloric restriction and then higher levels of physical activity than what we're actually recommended to get on a daily basis, we're not going to get that clinically significant weight loss. But weight loss is achievable in 80% of individuals. However, 80% of individuals are not able to maintain that weight loss. Even mild weight regain has been associated with regression in those cardiovascular risk factors, right? So that cholesterol, those blood sugar levels, that blood pressure. What are some of the factors for this weight regain? Well, I'm sure a lot of you have heard the buzz about those GLP-1 antagonists. So those new medications that are coming out there, right? So we've got increases in appetite hormones, and then decreases in these anorexic type of hormones. But reductions in compliance with self-monitoring and weighing habitats, that's the biggest thing, right? So if we just have that accountability, similar to this exercise as medicine program, where we know that we should all be exercising, but it's just difficult to do it sometimes, having that accountability of the trainer or someone that's in your group, and then that self-monitoring and then checking in and building those great habits, that's what's going to lead to this long-term weight maintenance. So the American College of Sports Medicine, as I mentioned before, they recommend that we need to obtain at least 200 to 300 minutes of that moderate physical activity. So now we're doing 60 minutes a day, 5 days a week, and that's going to get to that 300 for that weight maintenance after weight loss. So all of this is really, really important to build those long-term lasting behaviors. So we're making lifestyle changes and we're not just focused on one specific number for that weight loss, because we need to build those good habits in order for us to be successful long-term. So, we talked about this, and the big thing here is, if we're going to be successful, so this is a graph here that looks at weight maintenance 4 years past an intervention. What has led to continued success in terms of maintaining that weight loss? And it's all been about your energy expenditure in a given week. So the more we exercise in a given week, the better long-term weight loss that we're going to have. And again, this is 4 years after the fact. So those folks that were exercising in excess of 2,000 kilocalories per week, maintain a greater than or equal to 10% reduction in weight loss 4 years after they lost that weight. And the results of that are stemming primarily from support from specialists in terms of your exercise, your behavior, your nutrition, and that community. Again, that support and that accountability. So yeah, we can be effective long-term through physical activity for weight maintenance, and just making sure you have the right tools in your toolbox in order to be successful. So, just a quick table here to summarize expected weight loss from exercise programs. So if you're just going to be doing, that low impact Zuba, right? So that aerobic exercise training, if we're talking specifically weight loss, now we're not talking about those improvements in cardiovascular risk factors, but if we're looking at weight loss, 0 to 3%. If you're looking at resistance or strength training, only 0 to 1%. Aerobic and resistance training, about that same 0 to 3%. But we really, if we want to get to that clinically significant, I know I keep repeating this, but if we want that 5% or greater weight loss, we're looking at calorie restriction combined with aerobic and exercise training. And then the big piece is once that weight comes off for that long-term success, making sure we continue those high volumes of exercise. Okay, so now that we kind of just put a little scope around what physical activity is, how much we should be doing, and then whether we can get any type of weight loss or weight maintenance goals through exercise and diet, or a combination or exercise, diet, or a combination of both. Let's look at how the programs here at Ohio State are comparing with what we've seen in the literature. So this is our exercises medicine population. And this is telling a little bit different story from that national and Ohio perspective, right? Because even though men are more likely to be exercising and meeting those standards, women are more likely to be taking the effort to actually start these programs to make those changes. Over 70% of our population is female. And, a pretty standard mix of race and ethnicity as what we'd expect here in Central Ohio. And this is just some information here, not really that important for this conversation, but, we have a nice range of insurance types as well. So our exercises medicine program, so not focus on weight loss here. We're just looking at increasing physical activity. We are seeing about a 3-pound weight loss, 2.5-pound weight loss. We're seeing drops in body mass index or BMI. But here's the big one for us, and this is what we're shooting for. We want to get people to meet those exercise guidelines at a minimum. And when individuals start, they're below that. They're below 100 minutes per week. And we're adding 114 minutes per week. So by the end of the exercise and medicine program, we're exceeding those recommendations of 150 minutes per week. We also see some nice changes in systolic and diastolic blood pressure. Again, exercise primary outcome benefit are those reductions in those cardiovascular disease risk factors. And then we're seeing nice changes in a positive sense for our depressive symptoms, our perceived stress, our mental health, and our physical health. So when we combine exercises, medicine, the physical activity with nutrition education, so this isn't calorie restriction per se, this is just the education on good nutrition, you can see we get a much greater loss in weight, around that 6.5 pounds. And very similar numbers in those cardiovascular disease risk factors, right? So getting a nice increase in physical activity, reductions in blood pressure, and improvements in depressive, stress, physical, and mental health component scores. I mentioned earlier, some of the programs that I also manage are our Living Well and Healthy Living programs and our comprehensive weight management programs. So those are non-surgical weight loss programs. So these are structured specifically for weight loss. So they're much more intensive. You're going to have dietitians, exercise physiologists, licensed counselors, and you're going to be working really, really closely with those individuals. But again, you can see primarily females around that same kind of median age and similar race and insurance as what we'd see in exercise medicine. Again, this is a fee-for-service, out-of-pocket program. This one lasts 6 months. So in our weight, 0 to 3 months, we're getting close to that 5% clinically significant reduction in weight loss. And again, this is because we're having many, many more specialists involved in the plan of care. It's a lot more intensive. It combines physical activity, calorie restriction, and that mental health and well-being counseling. And then 0 to 6 months, right close to where we saw what the literature was reporting, anywhere that 10 to 13% weight loss after 6 months in our Living Well Phase 1 program. Okay, so one thing I just want to touch on, what's the next step? I talked about a lot of times people are self-reporting that physical activity. We want to see if we strap, like, I've got a Garmin on my wrist here. If we put Garmins or Fitbits on individuals and we get this, quantitative or this objective measure of physical activity, are we seeing those same changes? Because everything I've reported to this point for our programs has been self-reported. But we're going to build these wearables in for not only validation of that physical activity, but we really want to look at this connection and support, the communication that can occur because of these platforms, whether it be message boards, competitions, step challenges, all those things that really play into building community and support that are going to lead to that long-term efficacy of meeting those goals that we set out. So before I open it up here for a few questions, as we're coming up on our time, diet and exercise is better than diet, and diet is better than just standalone exercise in terms of weight loss. We say we can't out-exercise a bad diet. So to get to that clinically significant weight loss, if that's one of our goals for the new year, we need to have 6 to 12-month programs for weight loss, and then even longer for that weight maintenance. So a really good idea of kind of stacking these different programs that are available, so it doesn't seem like too much of a undertaking to sign up for a 12-month program. Maybe stack some of these 3-month programs, these 6-month programs, and then you'll get to that 12 months. But really having that support for diet, exercise, and behavior change. The best use of exercise alone is for our weight maintenance, like I mentioned earlier. And to get that, you really need to exceed those 150-minute per week physical activity guidelines. And we just really need to develop innovative ways to increase long-term adherence, connection, and support. And I think that technology is going to play a big role in that in the future. So I just want to shout out to our great exercises medicine team, all the staff there, the trainers, our statisticians, and our leaders. And then our non-surgical lifestyle program folks over at Martha Morehouse. Also, really, really great staff, really helping people make some changes in their lives. So if you have any questions for me, I will start to actively monitor the chat now. But you can also reach me at exercisesmedicine@osumc.edu for any follow-up questions, or just go.osu.edu/EIM. So I'm going to stop sharing. I'm going to stop recording. And I will monitor